Now it's a time to talk about compliance. When we inflate the lungs within our system, pressure is created. This pressure can vary from patient to patient and depends on lung compliance. The term compliance comes from the root comply, to fulfill a request. In other words, we ask the lungs to accept a certain volume of air. How well the lungs can fulfill our request is called compliance. Compliance equals V divided by P. Compliance is the ratio of change in volume to change in pressure. This means that if a large volume enters the lungs during ventilation without a change in pressure, compliance C is high. If the pressure within the system increases while volume is being delivered, it indicates a decrease in compliance. C. Good compliance means high compliance, indicating we can deliver a lot of air, and the lungs cooperate and fulfill our request to receive the volume we intend to inflate them with.